I first was involved with the Patient Family Advisory Council when it started. There were some people from OhioHealth that wanted to put a group of patients and caregivers, which I thought was wonderful, together to give our experiences and our ideas of what would go into the perfect cancer center if we could design it from ground up.
To see everybody's different vision come and to be one and to create this product is just so exciting.
The patient is the one who goes through the experience of cancer. And so creating a center from the patient's perspective as opposed to from the medical perspective, while that's important, is part of the healing process. Having a place where you could put all of the resources together in one spot was critical to all of us. So one thing that we love about this facility is it's all here together. And we can make it one-stop shopping. That was our theme through most of it. How can we make this one-stop shopping?
They'll notice that the room is called a great room and not a waiting room. When a patient gets a cancer diagnosis, they spend a lot of time waiting, and so they didn't want it to just be another waiting room.
We put the cafe back in the back, so it wasn't kind of a major feature when we come in. Initially, we had our retail space for patients that need prosthetics or hair pieces. We had that up front. And we got the idea from them that that wasn't the first thing that you want to see when you walk into a building.
I think 10 years from now, the community and us will look back on it and say, wow, we were really leaders in this. We really were the first to take the approach of caring not just for the disease, but the whole patient. I believe that it's going to start something new in our community, making sure patients have what they need, not just clinically, but to support them psychosocially, emotionally.
I'm hoping that this becomes the norm, that it's about a patient focus. We all have high technology, we all have great doctors, and I think it's time that we've put the focus on the patient-centered aspect of the care.
It's very humbling to have been able to be a part of this project. You know, we've all worked very hard, but to allow yourself to pause and listen to the patient stories and listen to how excited they are that, you know, maybe they've already gone through their cancer experience, but the next person will have a little bit better than them. That's what gets me really excited.
It's 5 to 7 years that this has been in the planning, and so many people have helped with it. It's just amazing how the team can come together and do something like this. We've wanted a cancer center for 2 or 3 decades, and it's here, so it's beyond words for me.
People with cancer want it to be focused on how do we live with it and less on how do we die with it. So one of the things that I love most about this committee is that it gave us a chance to do something about our cancer. We could fight it in this way.